Okay. See, the question asked to you was the topic that we discussed in the last class, and I was just trying to ask you, when do we think of ignitia? Or what are all the important mind symptoms pertinent to ignition? What are all the mind symptoms? Okay, they are duty conscious. Okay. Okay, one second, one at a time. They are very unpredictable, very good. Somebody used the word. Okay, somebody used the word, they are very moody people, good. Lot of emotions. Emotions are intensified. Okay, too much of emotions, and all those emotions are intensified. Good, right, nice point. Very sensitive, consolation aggravates. They are the kind of constitutions who would not like to be consoled. Okay, fine. Weeping alternating with laughing. Okay. Very competitive, very intelligent, very studious. People who get easily disappointed in love. See, that could be one point. Or, yeah, good. Okay, yeah, I know. See, okay, whenever we use the word love, agreed. So, people who fall in love very easily. Falling in love easily and also getting disappointed very easily. Okay. Falling in love with wrong people. See, not necessary it should be elderly people, wrong people. And one such example of wrong people is elderly people, married men. Okay. Yeah, good. Anything else? Yeah, they like more to be alone, introverted, company aggravates. Ailments from jealousy, we'll again talk about that. Sympathetic. Yeah, fear of birds. The other remedy that should come in brackets, China. Very good. Yeah, I'm happy with whatever you could recall. Good, keep it up. Shall we continue with Ignatia? So, I assume the mind of Ignatia or the mental symptoms of Ignatia are clear. Okay. Very commonly we use this remedy in our clinic. That's why I spent almost 60 minutes in the last class exclusively for Ignatia mind. Okay. Similarly, we'll talk of a few important things which again will have a practical touch. Okay. Now, when you start practicing, or for example, people like me who are already into practice, sometimes we find some unusual situation happening in our clinic. Meaning, for example, what could be that unusual situation coming up in clinic? We might have a person with bad inflamed tonsils. Okay, he's got a bad sore throat, the tonsils are inflamed. Fine. Now when you ask them, or when you see this particular person telling, sir, when I drink water, my pain is more. I have no issues eating. He can eat solid food. He can swallow solid food. But what is the main issue? He is not able to swallow liquids. So this is one situation we often get in clinics. Okay. Or people who have got bad swollen leg, knee. And if we touch, they start shouting. Okay. But when we press, they have no issues. Fine. So these are few examples that I am going to discuss in the next few minutes. Now what is it that you understood in one or two examples I am trying to give you? For example, I will talk of one more example which will come up. A person might have a lot of chills. Okay. And during the chill stage, he feels like drinking water. And during the heat stage, what happens in the heat stage? You tend to lose lot of fluids. So during heat stage, they will not feel thirsty. But during chill stage, they feel thirsty. So what are the common thing that you get in the three examples that I have given? Something which is very unusual. Something which is very uncommon. Very good, uncommon. So, if at all you have read Ignatia, or I don't know, under mind, if I try to mention, Ignatia is called as a great remedy of contradiction. Okay? Now whatever examples I have given you, where you use the word uncommon, unusual, peculiar, so these are all contradictory symptoms. Okay? Contradictory. So we'll just try to understand why Ignatia is called a great remedy of contradiction. So what are all the contradictory symptoms we have in Ignatia? There are plenty. I'll try to share some 15-20. Okay? And such situations you will definitely see in your clinic tomorrow, and you can use Ignatia. Okay? Now, I had a patient, who had a huge right ovarian cyst. She was under treatment. She had bad pains, okay? And she beautifully responded to our homeopathic medicine. Cyst disappeared, okay? And ultrasound shows there is no cyst. But she is a girl who still complains of pain. If you remember, first thing that I also spoke when I discussed Ignatia mind is, Ignatia is mainly thought of in which kind of diseases? Ignatia is mainly thought of in functional diseases. Meaning, there can also be structural changes in Ignatia, I don't deny. But this situation, you have bad pain, you get the scan done, scanning shows absolutely no pathology. Are you getting the situation? So you will be coming up with such situations tomorrow in your clinic. There is no growth, there is no structural thing. Scanning, reports, everything is normal, but the lady will be suffering. If everything matches, you can think of Ignatia. This girl was a very young girl, 11th standard. She had a lot of emotional issues at home, issues with her sister-in-law, brother, mother. She definitely had some emotional turmoil. Keeping all those things in mind, she was lately prescribed Ignatia. Okay? So when everything is normal, still the patient suffers. One remedy that should come to your mind is Ignatia. Okay? So a great remedy of contradiction. Now what is that? That is contradictory in Ignatia. See, they will have a lot of noise. They will have a lot of noise. And these noises, they feel better when they are listening to music. You already have noise internally. Okay? And these noises, they feel better in, by listening to music. Or Ignatia patient might have hearing issues. Okay? Meaning, they might hear better in a crowded place. I don't know, it's not there in books, but I am telling you out of experience. Ignatia patient might hear better in a crowded place. When they are alone, when things are normal, they might have issues with hearing, which is abnormal. Ideally, you will have issues with hearing when you are in a crowded place. So Ignatia will have opposite. So this is why we say contradictory symptoms. Many symptoms in Ignatia will be opposite. So noises better by listening to music, or hardness of hearing better in crowded place. Okay? Yeah, roaring, ringing in ears better by music. Okay. Now second thing you also have in Ignatia is they will have hemorrhoids. They will have hemorrhoids. Okay? And hemorrhoids in Ignatia will be better by walking. Fine? See, there is a growth. And naturally when you walk, you should have some kind of a discomfort. Okay? Which is normal. If she or he is an Ignatia patient, hemorrhoid pains are better by walking. This could be an example for contradictory symptom. Moving ahead, yeah, hemorrhoids better by walking. Moving ahead, now this is what I was trying to tell you. They have a bad sore throat. Throat might be congested. Okay? Throat might be congested. Now what was the symptom I told you? Dysphagia, difficulty in swallowing, better by what? Swallowing solids. And aggravation when? Liquids. When they are drinking some water, some fluid, they will have a lot of pain. it hurts, it pains. But they are able to eat solid food. One. Or second thing, a girl or a boy might complain severe pain in the throat. So what do you expect when you put a torch or when you want to examine the throat? What do you expect? You expect some kind of an inflammation. The kind of pain the person is complaining, sir, it is paining, very bad pain inside. So you expect there to be good amount of congestion, good amount of infection. Now what do you see shockingly when you put the torch in Ignatia? There will be nothing. Nothing means there will be no sense of inflammation, there is no sense of congestion, throat will be absolutely normal. But they will have problems. So this is what I was using the word functional diseases. Think of Ignatia. Okay? So sore throat better by eating solids. Okay? And aggravation, liquids. Headache, which I will be telling you in the next class when I deal with the particular symptoms. See, in headache, Ignatia has a sensation of a nail driven. Okay, they feel as if there is a nail driven. And this they feel better when they are lying on that particular side. Okay, so you have a sensation of nail and you feel better lying on the same side. Okay, so that's one very important thing. Sensation of nail better by either pressing, you press that nail deep inside, or lying on the affected part. Okay. Now any quick guess from your side, toothache in Ignatia. How will the toothache be in Ignatia? Very good. Cold aggravates or ameliorates? Ameliorates. Aggravates. Apart from cold, can you think of a contradictory situation in Ignatia? Very good. Toothache better by chewing. When you are chewing, you have no toothache. But when you are not chewing, tooth pains. Okay? Toothache, amelioration, chewing. Could be Ignatia. Okay? Eating, chewing is Ignatia. A common question asked in your exam for 5 marks, list 10 contradictory symptoms of Ignatia. Okay? I'll try to give more so that you can remember and you can reproduce minimum 10 in your exams. Okay, headache we just spoke, and we are also trying to understand. See, in Ignatia, you have another situation coming up. They have irritation in throat. This irritation in throat will cause cough. Once you start coughing, what should happen to the irritation? Irritation should be better. But in Ignatia, the more he is coughing, the more the irritation will become. Take a small pause, try to understand. So in Ignatia, they say, sir, I have irritation. And this irritation is bringing on cough. Okay. But does the irritation reduce after you cough? No. The more I cough, the more the irritation will become. Irritation in throat, tickling in throat, not better by coughing. It's an opposite state. Okay. Now going ahead, same thing I have written so that you understand better. I was talking to you about something very important in Ignatia related to fever. What was that we spoke? Yeah. In chill stage, thirsty. Fine. And in heat stage, thirstless. Or can we have something else? In chill stage, they will kick off all the covering. Fine. And in heat stage, you see them covering with thick blanket. Fine. See, not necessary everything should be given in books. You as a third year student should slowly start applying what could be the situation where one can think of Ignatia. So chill stage, they don't feel like covering, they kick off all the covering. Or in heat stage, they feel like covering. Thirst during chill stage, and during heat stage, they don't feel thirsty. Idu Ignatia. In fever. Now, we have something very important in Ignatia. What do you see here? You see some patient with abdominal discomfort. He's got discomfort with his abdomen. Okay. Now, ideally, what do you expect? when you have abdominal discomfort, what do you need to do? I mean, like you want or you prefer a bland diet or you prefer a spicy masala diet? So none of your Ignatia here. So ideally, when your tummy is upset, what do we expect is, we want to have something light, fine? Okay, so this is normal. In Ignatia, if he eats bland food, his tummy pain will increase more, or his discomfort will increase more. And Ignatia, discomfort in abdomen will be better by eating spicy, masala, fine? That kind of a thing they feel better. So this is again a contradictory thing. So we can think of more such contradictory things coming up in Ignatia. This is what I have written. When stomach is upset, what they are going to do. See, we have another very important thing. Okay, hungry, but not better by eating. They have increased hunger. What happens when you are hungry? You need to eat, no? Okay. They have increased hunger. They don't feel full. Or you can also think of Ignatia, increase hunger, but eating will not suffice. Eating will not reduce the appetite. You are hungry, you feel empty. So once you eat, you should feel full. So that situation may not be possible in Ignatia. Okay? And similarly, issues with sleep. Issues with sleep must be, when they tense too much, they might get good sleep. When there are no worries, when there are no tension, they might be awake. That is also a possibility in Ignatia. Okay? Now another very important symptom here is, any wild guess what am I trying to tell you here? Okay, let me not block. See, here, the symptom here is increased sexual desire, but there is impotence. Huh? Sexual desire increased with impotence. Sexual desire increased with impotence. Okay? Yeah, now, this is something easy. Very good, constipation. Good, go ahead. How will be the presentation in Ignatia patient? Yeah, very good. Yeah, you can make out from the picture, is straining. Your friend rightly said it is constipation. What is my question? Ignatia the constipation. What kind of stool do you strain? Hard. Normal, abnormal? 1 second. Straining for hard stool, normal, abnormal? Normal. Which is the remedy we are talking? Ignatia. And what is Ignatia? A great remedy of contradiction. So what do you expect in Ignatia? Not necessarily loose, soft. Sir, I put so much of pressure, but what is coming? The character of stools, they are soft. So straining or constipation for soft stools is Ignatia. Getting it or confused? Okay. Simple. Anything that is confusing is Ignatia. You don't get confused here. Fine? Okay, we'll come back. Now what is this? Nausea, vomiting. In Ignatia, what do you think will happen? Now you should start thinking and you should start answering. Beautiful. Nausea, vomiting, better by eating. So when you have nausea, what do you generally do? Ma, I'm feeling nauseous. No, I don't want to eat. You avoid. What will Ignatia do? Ma, I'm feeling nauseous. Give me food. That is Ignatia. Okay? So nausea, better by eating, or vomiting, better by eating. Yeah, same thing. Now, this is the example that I was trying to tell you. Knee is red hot, inflamed, swollen. Okay? And when you are examining, when you touch, what will the Ignatia patient do? She might shout. But when you press, she is comfortable. Okay? Fine? Okay, so this is again Ignatia. And another thing, last thing probably, or we can talk of one more thing, one more last symptom. There is itching. Itching, but no eruptions. Itching, they keep scratching, but there will be no eruptions. Itching without eruptions. Okay? Itching without eruption. One last symptom, we can keep adding many like this. One more last symptom I want to tell you in Ignatia, and then we'll talk of the other part of Ignatia. Now, what is the other symptom I was trying to tell you here is, in grief, when you lose some loved person, when somebody close to you dies, when you are sad, when you are in grief, how do you react? You start crying. Ignatia might start laughing. Okay? Ignatia might start laughing, giggling, laughing in grief. Okay? Giggling, laughing in grief is Ignatia. Beautiful remedy. You should not miss. Done? So, are the symptoms clear for you? Contradictory symptoms. Okay? Yeah. So, this was a small presentation on the contradictory symptoms of Ignatia. So, a small recap of what we did. We started with noise. Noise where? Noise in the ear, better by music. Very good. First point. Second? Hemorrhoids or hemorrhoidal pain, better by walking. Good. Second. Toothache, better by eating. Sore throat, better by swallowing solid things. Beautiful. Good. Then, pain in throat, bad pain in throat, on examination, there is no signs of inflammation. Good. Toothache, better by eating, we discussed that. Nausea and vomiting, better by eating. In there. Straining, constipation for soft stools. Okay. Fever, good. Fever, we spoke two things. Chill stage, they feel thirsty. Heat stage, no thirst. At chill stage, they might kick coverings. Heat stage, they might want covering. Good, agreed. Sleep. When stressed, they sleep well. When there is no stress, there can be sleeplessness. Sexual desire with impotency. Yes, agreed. Discomfort in abdomen, better by eating spicy food. Aggravation, bland food. Scratching without eruption. And those joint affections. So must be grief, laughing or giggling after grief. So these are few symptoms related to Ignatia. Any quick questions? Okay. Anything that is contradictory, fine. Tomorrow, if other things agree, you can think of Ignatia. That is the take-home message. Okay. So next 15 minutes, we have time. Next 15 minutes, we'll try to understand the sphere of action and ailment stone. So that next class, I can exclusively focus on the particular symptoms. They are also equally important. Okay. Under particular symptoms, we'll be discussing many of the contradictory symptoms only. Okay, we'll do that. Okay. Now, I'll just share another PPT. Okay. See, we'll quickly focus on the other component of Ignatia. So, this is how the plant looks. Saint Ignatius bean is the common name, and the bean is what we use in homeopathy. Does this resemble some remedy? More than anacadem. Must be, the picture is not clear. I am confident if the picture was clear, you would have answered. Very good. Who was that? Beautiful, good. Naxomika. Next, one of the girls was told, but she was not loud. Naxomika. If you remember seeing this in a pharmacy, the bee, okay? No. Okay, don't worry. If it is different, it is different. We'll not worry about that part. See now, probably Nux and Ignatia become very close. If you see the sphere of action, you will try to understand. They come very close. Okay. We'll quickly look at the sphere of action of Ignatia. CNS. By now you know many remedies acting on CNS. Can I have a quick and clear noise? Which are the other remedies acting on the CNS? Argentum, Gelsemium, very good. Agaricus, good. I'm happy. Naxonica, Hypericum, good. Hypericum mainly on nerves, not necessarily CNS. Belladonna, agreed. Natrum, Platina, good. Happy. In there, any other remedies? Calcarea, mainly a remedy acting on heart, but when you look, see calcarea also causes conversions. Epilepsy, fine, good. Any other remedies? Gelsemium. See, if I ask any other remedies, the idea there, trick there is, many remedies that are told, they are repeated. Gelsemium, Dubara, we have Naxomica coming up. Anyway, see, a lot of remedies. See, from your second year syllabus, we also have Etusa. We have Apis mellifica. Okay, fine. And the remedies, of course, you spoke of agaricus, a lot of other remedies. Okay, if time permits, we'll try to understand when these remedies can be thought of. Aconite itself is a beautiful remedy acting on the nervous system. Okay. Now, what will Ignatia do? China is also a remedy acting on CNS. What will Ignatia do acting on the CNS? Okay. Any wild guess? What will Naxomica do? What will Naxomica do? So when I ask this question, you have to be very clear. Sir, this Naxomica acting on the motor nerves, Naxomica acting on the sensory nerves. Naxomica acting on the motor nerves, what will it do? It will cause mainly paralysis. Acting on the sensory, what will Naxomica do? Sensory nerves. What do I mean by sensory nerves? Okay, so what is Naxomica going to do? It will cause oversensitiveness. It will cause oversensitiveness. That's why you don't see Naxomica, he can't tolerate sound. Avas kamkar, reduce the volume. Okay? You have Naxomica father entering the house. There will be pin drop silence. Before that you will be dancing, music, everything. Mera baap is entering the house, you either reduce or you switch it off and you are in place. Okay, so Nax will not like sound. Similarly, Nax is very, very sensitive to touch. Naxomica will have acute smell. Some road, biryani, something has been prepared, he can smell it fast. And Naxomica hearing, everything will be very sharp. Because Naxomica acts on the sensory nerves and it is causing oversensitiveness. You're getting a point. What will Ignatia do? So Ignatia mainly causes two very important things. One, you have a serious condition, paralysis. Okay? And second thing, in Ignatia you see more of, pitchings, more of jerkings. What is the word I used in Ignatia? Functional. Okay? So here, it could be more physiological. Something is deficient. Okay? So there can be jerks, there can be jerking like this, involuntary movements, pitchings. Okay? These things you might see in Ignatia. Or in burst case, you can also see paralysis. And paralysis, shockingly, when there is no structural problems. When you don't have a space occupying lesion, when you don't have some big pathology, okay, all reports are normal, but they go into paralysis. You can think of Ignatia. Convulsions without any big cause, okay, functional convulsions. I'll explain under nervous system. But remember, Ignatia acting on CNS can cause all those jerky movements, twitches and convulsions. Eyes, it will cause blurred vision. If you can see here, okay, there is blurred vision. Vision which is blurred, or this is a very important area. The mucous membrane of the nasal mucosa. More important for you is throat. Which are the other remedies having an affinity for throat? Huh? Okay, arsenic, bryonia, mud's are good. Any ophidias are over for you? See, do remember in ophidias, for example, lachesis, crotalus, any other snakes, this area is very, very sensitive. They cannot like somebody pressing, or they will not like some tight bandage, tie, collar, button, they will not like it, because this is a very, very sensitive area of the snake. How do we hold the snake? Do we keep the tail? Bala itkontiva, how do? What is the area we hold? Neck. Because once you hold the neck, the creature cannot do anything. That's a very sensitive area. So similarly, a person who requires ophidia, this area is very, very sensitive. Okay. Now, what will happen in ignition? What is the pathology, or what is the thing that you are going to see in ignitia? Ignitia causes something called as globus hystericus. I'll explain this under throat. Yeah, sensation of a ball. Sensation of a ball. You might see an ignitia patient telling, what is the ignitia patient trying to tell you? Sir, I feel something stuck. I feel something stuck. So that is ignitia. So globus hystericus is what you are going to see in ignitia. Stomach. Now you can tell me, we have already discussed, what will happen in ignitia and the stomach? What is it? It mainly causes emptiness, all gone sensation, as if there is nothing, empty feeling in the stomach, all gone sensation, empty feeling. Now what will happen in the rectum? Very good, hemorrhoids. Constipation. Now when I ask you the character of constipation, then you will be coming up with soft stool. But what is ignitia doing, acting on the rectum, is it can cause constipation, it can cause hemorrhoids. Okay, good. And what is this? Prolapse. What type of prolapse is this? No. As a surgery student, there is something called as precedentia. You never heard of this? Okay. Precedentia, meaning third degree prolapse, when the entire organ is coming out. This is purely surgical. Don't take up such cases. Fine? It's our limitation. Okay? So when everything has come out, you can't give a homeopathic remedy and then boss, you have given a remedy, yes, I'm coming inside, nothing like that will happen. It's purely surgical. Prolapse, I'm talking to you about the third degree prolapse. When the organ has come out from its original place, is our limitation. At least I put it, it's my limitation. I don't take such cases. Fine? It's my limitation. Let me correct myself. Okay. So, ignitia can cause painless precedentia. Remember, hemorrhoids, constipation, prolapse. Very important. Now, on the female, you saw that it can cause DUBs, dysfunctional uterine bleedings, okay, dysmenorrhea, cramps, all those things. So, before we take up the ailments from, the important thing that we discussed today was, one was contradictory, and second thing we just spoke was sphere of action. Where do you see ignitia predominantly acting? CNS, throat, mucous membrane, eyes, stomach, rectum, and last part we spoke was female genitalia. About some 6-7 areas. Okay. Now we'll quickly look at the ailments from. Any wild guess? One second. I have already given you the mind. Okay. One second. I have already given you the mind of ignitia. Okay. Now a 3 to 4 class fag end of the day. What could be the probable ailments in ignition? You said something. Okay, see, liquids In sore throat it will aggravate, but liquid will not be a causative factor. It can be an aggravating factor. Okay. But when I talk to you about causative factors, ailments from. Very good. 1 second. We'll go slow. We'll go slow. Jealousy. 1 second. Let me complete. No, I know. You're all eager to answer. I appreciate. Now, jealousy. What is that you have in Ignatia? I told you. Beautiful, good. I told you a situation. I gave you a statement from the Materia Medica. What is that statement? Yeah. When the newborn takes away the attention. Okay. What was the situation I gave you? Till my younger brother is born, I was the king, or I was the prince, or you are the princess. One more younger daughter or younger brother, sister comes up. What is happening? You are not given so much of attention because a new prince or a new princess is born. So that's where Ignatia will have issues. And I also clearly told, how will an Ignatia child present? Very good, fever, more than fever. Nervous complaints. They either throw away a jerk or they throw away a hysterical convulsion. When you take an MRI, there is nothing in the MRI. All fine. This is where homeopathy has a beautiful scope. All fine. But from the day the newborn is there, this child is started throwing convulsions or some nervous complaints. That is Ignatia. Ailments from jealousy. Very good. Now, what could be the second ailment? Ailments from disappointment in love. Beautiful. Good. Valid. Ailments from disappointment in love. Okay? So the boy, the girl, somebody ditches you and then you start going into disappointment. Good. Ailments from disappointment in love. Good. Ailments from disappointment in general. Okay. Ailments from failures. One more very important thing you can answer. Ailments from, very good, grief. Ailments from death. Ailments from sorrow. Ailments from losing some close person. Okay. I had a case. It's not got nothing to do with Ignatia, but then this case was of a lady, an elderly lady, around late 40s, 48, 49. She had asked her mother from Andhra to come over to Bangalore. Unfortunately, COVID was in the peak. Okay. And this lady got COVID and she expired. Since then, my patient's BP has gone high. And I was trying to understand why BP went high. She didn't tell me. And then when we sat and when we tried to understand, your BP was normal, what happened, why did it go high? Then she started crying, sir, see, I made a big blunder. I asked my mother to come to Bangalore and because of me, she died. Why because of you she died? Yeah, because I was the one who asked her to come, no. If I wouldn't have asked her to come, she would have been alive today in Andhra, happy. I made a mistake. I asked her to come and then she died. So two things were taken, reproaching self and ailments from death of loved ones. And the remedy that came up was natrum here. So beautifully natrum helped her. So ailments from death of loved ones, Ignatia, natrum, aurum. Ailments from grief, yes. Ailments from grief, ailments from, what is this? Disappointment in love, okay. Yeah, ailments from disappointment in general or ailments from loss, death of a loved one. And you could have added few more ailments. Yeah, see, for this you should have recalled the mentors that we discussed. Ailments from scolding, okay. They're very, very sensitive. Ailments from, what is that image? Very good. Ailments from homesickness. You are away from home. You are missing your parents, you are missing whatever. Homesickness. Beautiful remedy, Ignatia. Yeah, ailments from fear, fright, anger. sadness, and this is the situation your friend was talking about, ailments from jealousy. Good, correct, ailments from jealousy. Not necessarily heart, coffee. Coffee. Ailments from coffee. The physical ailment we are talking about, ailments from coffee and ailments from tobacco. Ignatia girls will not like the smoke smell. Ignatia's boyfriend will have a tough time because Ignatia will not like smoke, tobacco, fine. So ailments from tobacco, coffee. Yeah, what is this? Ailments from shock, some sudden shock. Okay. Ailments from listening to bad news. See, this bad news itself can be a shock. Fine? Okay? Ailments from bad news, ailments from shock. Yeah. And ailments from consolation. She'll not like somebody consoling her, or ailments from alcohol. Okay? So, Ignatia has good amount of ailments. Starting with the emotional ailment, scolding, jealousy, anger, fear, fright, shock. And it also had some physical ailments. Physical ailments includes coffee, tobacco and alcohol. Okay. So these were few ailments of Ignatia. So 3 things we have discussed for today. One was contradictory symptoms, sphere of action and pathogenesis and ailments. Any questions? All clear, boys? So if things are clear, next class we'll try to take up the particular symptoms. So with that we'll be done with Ignatia, and hopefully after Ignatia we'll talk of sepia. Beautiful remedy. Okay? Sepia, and you have anacardium, few big remedies. I'll try to finish it. Okay? We'll close. Chalo, thank you.